Thank you very much. Hi, everyone. We'll get going with the numbers. Provincially, we're at 3,295 increase as of from yesterday. Again, the trend keeps going upwards. As you know, today there was the enactment of the Emergency Measures Act, and a stay-at-home order was added, and I think that was very much needed, and as well as some additional restrictions, including something that we had asked for before was obviously the big box stores to be limited to groceries and other essentials, and that happened this time. So I think that with these measures moving forward, I'm hoping we'll be able to get a bit of a control of the seemingly increasing numbers. And in our area, we've had, I think today was a record actually. If we look at our numbers that we just put up this afternoon, um, we were at 470, but we added. Actually, let me go to the change first. We added 63 cases today, which I think is a record for one day. Most of them were in Prescott Russell, and we're getting a lot in school-age children there. And we've actually closed multiple schools yesterday and today. Again, sporadic cases here and there. Only a few had, outbreaks related to them, but it's because we've had so many classes have cases in different areas, not related to each other, but causing operational issues. We actually had to close a couple more down, and as you know, they will be going on a spring break as of tomorrow's the last day. So hopefully they'll be able to not get together over the holidays. We believe that what we're seeing now is likely reflective of last weekend, Easter weekend. So hopefully we'll start to see the numbers go down. In terms of our rolling average, again, we're still, although we're seeing a bit of a downturn here in Cornwall, you can still see that we're still clearly in, way above the red zone into the sort of the gray territory of all those areas. So again, we need to be quite careful with that. In terms of our hospitalized, we got 35 hospitalized, 8 in the ICU, including 17 at the Cornwall Hospital and 4 and of those 4 in the ICU in Cornwall, and we have 12 at the Hawkesbury and 1 at the Winchester. The remainder are in Ottawa. So, we're still seeing significant numbers. We had an additional death, and that was in one of the hospitalized patients, and I'm still getting some details on that one. And we just continue to vaccinate. So if we look at our numbers in terms of our outbreaks. Again, our long-term care facilities, I think there's only one now remaining, two actually, that have residents in them. The Chartwell McConnell Manor continues to be an outbreak, although we're waiting for some results that we did on the 5th, and hopefully we're closer to closing that one in terms of the declaring it over. And again, when I'm looking at our other ones, we've a couple of outbreaks have been closed very recently, and if I'm looking at, and like I said, there continue to be, with the exception of another one, St. Joseph Continuing Care, where there's some residents that are positive. The remainder are residents and not staff. So that's where we're at with that. In terms of schools, like I said, we've had multiple cases, more in the Prescott Russell area, and our staff has been very busy over the last couple of days working with the schools and sending letters and doing the assessments and so on. In terms of vaccinations, I just wanted to go over a few things and bring you up to date on what's going on there. We have been now planning for our clinics, like I said, in sort of blocks. And the reason we do it in blocks is that's when we get our allocation supply for a 4 to 5 week period. We're now over 30,000 vaccines. I know we're showing 29,000, but there's always a couple of hundred that are missing that we put afterwards into the program. And those exclude the clinics that are going to be today and moving into the next couple of days. So all in all, we know that we will have in hand an additional between April 6th and May 7th. We will have an additional approximately 37,000 doses to be able to distribute in our area. And we have now are now going to be doing bigger mass clinics, mass immunization clinics. And we've scheduled, for example, this current week, we've had 12 clinics total. And that finished kind of our first wave of those weeks that we had planned, March 17th to the week of April 7th, which is this week. In that, we had actually 39 clinics, including I think 16 in Cornwall at that point in time. And so right now, as of today, like I said, we've got a clinic in Cornwall, got a clinic in Rockland, and a clinic in Alexandria as we speak. And so those numbers are not added. There's going to be another at least 600, at least another 12, 1,300 doses being delivered today. Tomorrow, we're having one in Castleman and one in Cornwall again. And then on Saturday, we're starting a bigger mass immunization clinics where it will in Rockland, where we will have the likely about 1,000 doses being given that day. And the same, we're actually starting our big mass immunization clinics now. Now that we had finished in Cornwall Square, tomorrow will be our last in Cornwall Square. It's very amenable to the senior population, and as we're now going into more mobile population, as you know, 60 plus have now now being able to make an appointment. And so we're opening, like I said, we're doing our first big clinic at the Cornwall Benson Center in the dome, in the soccer dome area, where we anticipate delivering over 1,000 doses in that period. And then moving forward, we're going to be doing 8 mass immunization clinics on a weekly basis. Each one delivering about each week delivering at least 8,000 doses. So that'll take us to the first week of May. And I can tell you that the booking system is starting to work now. We've had some kinks, some bugs in the system there, but in terms of our booking system, as of April 6th, we had 8,261 people booked. As of yesterday, we had 12,000 people booked. And as of this morning, we had 26,000 of those 37,000 spots booked already, and so they're filling up very nicely. Now, we do know that there might be in the interim some increased number of dosages, and at that point we're going to add more clinics during that period of time as well. So at the end of this, if you kind of look at the math very roughly, having done at least 30,000 right now and done another 37,000, we'll have done about 67,000 doses in our area. And most of them are first doses, obviously, and that's about, like I said, our population to vaccinate is about 170,000 total. We're looking at about 80% be vaccinated. So we're going to be in about 67,000, 68,000. That doesn't count our AstraZeneca, which will bring us up a bit higher. And so we'll be looking at a 40-50% of the population vaccinated by the end of the next 4-week period. So that's provided we don't get other vaccine. If we get more vaccine, we'll increase it at that point in time. And I just want to clarify a few things. In terms of AstraZeneca, we are about to receive some AstraZeneca for our primary care clinics. We have a couple that are going to start, and we're going to ramp that up as well. We also know that there's 3 pharmacies in our area that have already or going to be starting shortly. One in Embrun, one in Hawkesbury, and one in Winchester. We are working on very, very strongly to get at least one, if not 2, in Cornwall and some other areas like Alfred and Ingleside. We're trying to look at high risk areas and also areas that have less access. So we're trying to work with that. At this point, like I said, we have not had any say in the selection of the pharmacies, but I sent a memo out this morning to the ministry saying that I'm frustrated at the fact that we can't, and we need we need to have a more logical approach of where the pharmacies will be. And I know that they're going to add more. So there'll be a pharmacy capacity and primary care capacity as well added to these numbers as well that we're projecting. So we're just continuing to move along. One of the things that I just wanted to highlight is I know yesterday We had some issues in the Hawkesbury clinic. I must say that most of our clinics now are running very smoothly. It's the first time that I'm getting positive remarks from like multiple positive remarks from clients coming in unsolicited. People saying they had a good experience and thanking us and congratulating us. Multiple, and usually we get negative comments, so it's nice to get positive ones. But yesterday there was an issue at the Hawkesbury clinic where all of a sudden more people showed up than we thought, and they were showing up much more frequently, much more, at the same time. And we were, we something was wrong. So what happened was not dissimilar to what happened in Ottawa the previous week. The system, for some reason, that's the provincial system, had overbooked the clinics. They had overbooked them, and in some situations had planned appointments every 2 minutes, and we didn't have them on our list. So there were people that showed up that weren't even on our list. And to make matters worse, these are the people that had booked before early on and had booked with the system before they updated it. And the system at that point, they did not match for the hour change. So a fair amount of people showed up an hour earlier because their appointment was not adjusted to the change of time that we had, the spring ahead. So anyway, so there was a lineup there, and I know that there was some Facebook or some ads, some that unfairly, I hope unfairly, showing that this is it's not. Let me tell you, if people got the impression that this is what's going on in our clinics, that's unfair and it's wrong. This is a one-off that we've had, and we will be working on it immediately. But again, we spoke to the ministry, and they said that has been rectified. Those bugs have been rectified, and those were in the earlier days of clinics that were booked earlier on. And so at this point, we're confident moving forward that we won't have that again. So again, it's kudos to our staff because they had to pivot very quickly and manage. They didn't turn anybody away and vaccinated the individuals. And at some point, by the sort of the middle of the clinic, everything they had caught up. So I'm very grateful to them for that. And again, we're trying to do the best we can, and I do appreciate that. Again, sometimes people should need to appreciate that those are not under our control, but where we can control it, we'll do our best. And like I said, if there's any bugs in the system, we will obviously work with the ministry so they can change it, and they usually respond quite quickly. Bon, je vais commencer avec les chiffres ontariennes. Nous avons pas mal des cas encore en Ontario. Bien sûr, on a augmenté de 3 295 cas depuis hier, et ça fait quelques jours qu'on est dans les 3 000, toujours à Toronto, Peel, etc. Et comme vous savez, on a maintenant une ordonnance, un état d'urgence qui était déclaré dès aujourd'hui, qui, en effet, c'est une ordonnance de rester chez vous, restriction un peu plus stricte au niveau des magasins de détail fermés, seulement les magasins qui vendent les choses essentielles. Et pour la première fois, les grands magasins, les box stores, sont pas permis de vendre des produits seulement, sauf pour des produits essentiels, alimentation, médication, etc. Donc, j'espère qu'avec tout ça, on va avoir une diminution des cas parce que même dans notre région aujourd'hui, je pense qu'on a un record. On a augmenté nos cas par 63 cas dans une journée. Et ça, je pense vraiment, je me souviens pas d'avoir une augmentation si importante qu'aujourd'hui. Donc, on voit par contre qu'on a augmenté, je vais vous montrer ici, par 63, 34 à Prescott Russell. On a beaucoup des enfants qui sont positifs. On a fermé pas mal des écoles depuis hier et aujourd'hui, parce qu'on avait plusieurs cas dans plusieurs classes, mais pas reliés entre un autre. Mais par contre, juste le fait qu'on devrait isoler la moitié de l'école, par exemple, parce que c'est des petites écoles, on a fermé les écoles. Bien sûr, ça fermera demain quand même. Ce sera la dernière journée avant le relâche qui va commencer la semaine prochaine, donc pour laquelle j'ai peur que je ne veux pas qu'on voit la même chose qu'on voyait période de Noël. Les personnes devraient rester chez eux, les enfants pourraient jouer avec ses pairs, mais virtuellement, pas face à face. Parce que on ne veut pas que la même chose arrive après Noël qui est arrivé après Noël. Bien sûr, nous avons peur aussi que ce qu'on voit aujourd'hui et demain, là, on a eu 63 cas. Je ne peux pas exclure la possibilité que c'est relié au party ou les événements reliés au Pâques ou le fin de semaine qui vient de passer, parce que là, ça fait le timing est bon, là, 4 à 7 jours. Donc, j'espère qu'on va avoir diminution avec toutes les ordonnances qu'on fait. Au niveau des moyennes mobiles, vous voyez malgré ça va un peu mieux au niveau du Cornwall, au niveau de le 7 jours de cas de COVID-19, les moyennes mobiles, on voit qu'on est toujours dans la zone rouge ici. En effet, beaucoup plus haut que la zone rouge. On est vraiment dans la zone gris. Donc, c'est très important qu'on continue avec toutes nos précautions. Au niveau des maisons de longue durée et les flambées, on a juste deux qui ont des résidents, trois qui ont des résidents. Les restants des flambées que nous avons sont les employés dans ce sens. Au niveau de l'hospitalisation, je peux vous dire qu'en effet, nous avons 35 à l'hôpital actuellement, 8 aux soins intensifs. Donc, 17 sont à l'hôpital de Cornwall et 4 aux soins intensifs. Parmi les 17, 12 à Hawkesbury et 1 à Winchester. Les restants sont à Ottawa. Donc, on a pas mal des patients hospitalisés. Parmi ceux-là aux soins intensifs, on a 2 qui ont l'âge d'à peu près 5 ans, dans les cinquantaines. Donc, on voit plus en plus les personnes moins âgées admises à l'hôpital avec COVID aux soins intensifs. Donc, on va passer au niveau des vaccins. Donc, nous avons, jusqu'à aujourd'hui, nous avons comblé au moins 30 000. Ça monte 29 quelque chose, mais au moins 30 000 et ça ne compte pas les 3 cliniques qu'on va faire aujourd'hui. Et on a une pour demain aussi. Donc, on va ajouter une autre 1000 à peu près à ce moment-là. Il faut dire que nous avons des plans pour les prochaines 4 semaines, soit jusqu'au la semaine du 4 de mai, qu'on va avoir des cliniques, les cliniques hebdomadaires quotidiennes. On a fait plusieurs à la fois parce qu'on a estimé que nous allons recevoir à peu près 37 000 doses de vaccins. Il faut dire que le vaccin, la plupart, c'est Pfizer et on va recevoir Moderna aussi cette fois-ci. Donc, on voit que cette semaine, déjà, nous avons fait plusieurs cliniques. Donc, il reste aujourd'hui, on a une à Rockland, une à Cornwall, une à Alexandria qui va avoir à peu près 1300 cas, 300 doses de données. Et demain, on va avoir une à Castlemilne, en Cornwall encore. Encore, on s'attend à peu près 700 doses. Et samedi, on commence les gros cliniques aussi. À Rockland, il va y avoir une clinique, une massimisation, à peu près 1000 doses on a 1000 places déjà bookées. Cornwall, ça va être au Benson Center cette fois-ci. On va aussi avoir plus que 1000 doses de données. Donc, ça va commencer au soccer, au Dôme. Et pour les 4 semaines après, on prévoit de faire au moins 8 cliniques par semaine. Avec chacune, et à chaque semaine, on va approcher le 8000 doses de données. Donc, on va approcher à la fin de ces 4 semaines à peu près 37 000 de doses de données. Si on rajoute les 31 000 qu'on va déjà donner, qui sont la plupart les premières doses, on va être rendu à 67 68 000. Donc, on a une population de 170 000 à peu près qui pourront être vaccinés dans notre région si on prend 80 donc c'est 150, donc on va être pas mal à 40-45 pendant ces périodes d'urgence et de rester chez vous. Donc, le plus qu'on reste chez nous, le plus qu'on vaccine, on va être dans meilleure place quand on va sortir avec tout ça d'ici 4 semaines. Donc, espérons qu'on pourrait continuer avec ça. Je vais juste parler un petit peu des problèmes qu'on avait à Hawkesbury. Faut, malgré que la plupart de nos cliniques vont bien maintenant, en effet, nous recevrons à chaque jour 3-4 compliments et remerciements de la façon que nos cliniques sont efficaces, etc. Hier, on avait un problème qui était dû au système provincial de réservation qui ont booké plus patientes qu'on attendait. Et la même chose est arrivée à Ottawa il y a quelques semaines. Ils ont booké 3000 de plus. Donc, c'est un problème du système. Et aussi, les personnes qui ont booké avant qu'on avait changé le temps, l'heure qu'on a avancé il y a quelques semaines, ils n'ont pas changé le temps. Donc, on a reçu un paquet des personnes qui ont arrivé 1 heure avant leur rendez-vous que nous avons eu sur nos papiers parce que pour leur confirmation n'a pas été changée pour prendre compte le changement de l'heure qu'on a avancé. Donc, je veux juste dire qu'il y avait des gens qui avaient une gros fil. Je me sens pas bien pour ça. Mais en effet, l'équipe a fait un travail exceptionnel pour qu'on puisse. On n'a pas refusé aucune personne. On a tout vacciné, mais ils ont travaillé fort, donc je suis fier et je veux les remercier. Je ne veux pas que les gens, parce que ça a été sur Facebook, je ne veux pas que les gens pensent que toutes nos cliniques sont comme ça. En effet, ça, c'est exceptionnel. Et nous avons tout de suite parlé avec le ministère et là, ils ont déjà changé, ils ont déjà corrigé les problèmes qui ont fait ça. Et jusqu'à date, je peux vous dire que au niveau des personnes parce que vous savez aussi que dès mercredi, hier, on prend les personnes 60 ans et plus. Il faut dire que le 6 avril, juste pour donner le débit avec lequel on pourrait réserver, le 6 avril, on a eu 8260 rendez-vous de fête. Ça a augmenté à 12 000 quelques hier. Et aujourd'hui, ce matin, on était à plus que 26 000 des rendez-vous donnés déjà sur les 37 000 qui nous restent. Il faut dire aussi que toutes les projections que nous avons sont basées sur le fait que nous allons recevoir à peu près 37 000 doses d'ici la première semaine de mai, mais ça exclut les doses potentielles qu'on pourrait en recevoir. Parce que Johnson Johnson va commencer, ça se pourrait qu'on reçoive un peu plus de Pfizer dans quelques semaines. Donc, si ça arrive, à ce moment-là, on va ajouter d'autres cliniques. Mais pour le moment, chaque clinique qu'on va faire va donner à peu près, on va vacciner à peu près 8000 personnes parce que ça, c'est le débit, ça, c'est vraiment le montant qu'on va recevoir d'ici là. Donc, espérons que on pourrait avoir un peu plus, mais comme j'ai dit tantôt, on va avoir vacciné pas mal du monde juste avec ça. Il faut dire aussi qu'AstraZeneca, ça s'en vient. Il y a 3 pharmacies déjà dans notre région, une à Embrun, une à Hawkesbury et une à Winchester. Et il va y avoir 3 autres. J'étais un peu déçu avec le gouvernement parce qu'ils ne nous ont pas consulté auquel pharmacie et parce qu'on voudrait absolument avoir une au Cornwall au moins une ou pas deux, parce que Cornwall a pas mal des cas maintenant. Et on voudrait avoir dans des autres places comme Alfred et aussi à Ingleside, parce que oui, c'est le haut risque aussi, les hotspots, mais aussi les régions juste pour vraiment avoir un équilibre au niveau de la disponibilité. Donc, j'ai envoyé une lettre aujourd'hui en disant que je n'étais pas contente. Je voudrais avoir des cliniques, des pharmacies qui vont l'avoir. Donc, je suis pas mal confiante qu'ils vont le faire, qu'on va avoir. Et on va avoir aussi accès au AstraZeneca. Nous allons aussi fournir les vaccins aux nos partenaires cliniques primaires, les médecins de famille, les cliniques de médecins de famille, médecins communauté santé, les centres communautaires de santé aussi. Donc, il va y avoir pas mal des personnes et aussi nos hôpitaux vont avoir accès pour donner le vaccin, Cornwall déjà, et les autres hôpitaux aussi. Donc, je pense que avec tout ça, on pourrait continuer à vacciner, on pourrait offrir le vaccin. Et si ça tombe qu'on reçoit plus, on va ajouter des cliniques. C'est si simple, c'est pas plus compliqué que ça. Nous, on se base sur les projections d'allocation qu'on va recevoir. Ils font ça à quatre semaines d'avance à la fois. So that's it. I'm going to look at the. I'm just going to look at the questions that I got here. I keep losing my papers. I keep mixing all my papers up. I've got it somewhere here. Here we go. Question here is which vaccine are we getting? Okay, so I think I said it in French. I didn't say it in English, Nelson. It's we're getting right now. Most of it is Pfizer, and we're getting some Moderna as well. The AstraZeneca is going to be more in the pharmacies and the primary care. Most of our mass immunization clinics are either a Pfizer or Moderna. I have another one by Nick Seabrook. The EOHU issued a stop work order for the residents at 432, 434 Augustus in Cornwall. Was this order given to halt demolition of the building? Yes, we were. There was a complaint made, and we got a call about a very it was a bad shape. The building was in bad shape. It got garbage. It was going to be demolished. But a lot of the neighbors were complaining that rats were running around. It was rat infested, and the plan was to demolish it. But the concern was if we demolished it, the rats would just run loose and go and infest other areas. I know that it was close to some other centers, close to a church and other residential areas. So what we did is we sent our inspector with the Cornwall inspectors as well, and they ascertained. They sent me some pictures. I mean, this house was inhabitable. It was the doorways and everything was opened. You couldn't even get in. It was garbage blocking. There was all kinds of objects blocking it, and so we did not want this to be demolished. So I issued an order that prevented them from demolishing it before getting an exterminator to ensure that they exterminated as much as possible the rats, so that on demolition it would be a safe demolition and not disperse the rats in the area. And that's why we ordered that work stoppage. Got tremendous cooperation from the city of Cornwall and the Cornwall police as well in that regard. Yeah, the other one is about hospital capacity. As you see now in our hospital, the Cornwall Hospital is right at its limit. They've got 4 ICU and 17 total COVID patients, and they've got others, so they're at their limit, and that's what our concern is. We want to make sure that we collectively were able to bring those numbers down, because the lower the numbers, the lower percentage gets hospitalized, and which means lower number of people in the hospital. The address. I have a question here from Hugo. Hugo, there is a definition of essential workers, and I don't have it off the top of my head, but I'll get it to you. I'll send it to you. Info wasn't available Tuesday. Asking again, what percentage of eligible groups have already had their first dose and have their appointments booked? What percentage of eligible age groups? I don't have that either. But it's hard for us to get that out, but we can get that. Like I said, I just gave you the total number of people getting vaccinated and the people that are booked already. Are there any clinic sites that are routinely underbooked? No, at this point, no. With the start of the next phase, which populations would be encouraged to be registered? Again, we were expecting to start with the essential workers. Right now, we're working with our highest risk patients, and we were expecting to move forward with teachers and first responders and so on. So that would be my best bet. Looking at that, I know that there's been the special ed teachers are going to be there, and I know that in hotspot areas they're going to do teachers as well. My suspicion is that we're likely going to move into teachers as a next phase, but we're still waiting for direction from the ministry in that regard. And there's a question about some Cornwall outbreaks. I can tell you that if there's an outbreak in a school, it's because we've linked the two cases together. We've had multiple schools that have multiple cases, but not linked to each other, so we did not declare an outbreak. And that's it, Jenna.
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Hi, Dr. Paul. So the change in vaccination policy where in hotspot locations, people 18 and older will get a priority, is that going to impact the supply of vaccines coming into other regions outside of the hotspots?
I don't think so because I know that the ministry has holds back a certain percentage, and they're going to dip into that. We have not been told of any changes in our allocation between now and the May date that I told you before.
Okay, and the hotspots seem to be like a proportional type of thing. Like you have an area, and then there's an area within that that is has more infections. So proportionally speaking, are there hotspots in the EOHU that might get a priority?
No, at this point, I saw the list. We're not on that list. The only one that I'm looking at is Cornwall. I can tell you that I'm looking at Cornwall in terms of the numbers, in terms of the rates of infection, but we're not listed as a hotspot. There's 3 or 4 postal codes in Ottawa, and the rest, if you look at the hotspot sort of appendix, are mostly in the GTA area.
Okay, and lastly, I've talked to a number of business owners in this area. The common theme is that they feel like they're getting punished because of this latest emergency order and shutdown, primarily because the spread is happening in distribution centers and manufacturing plants or in private gathering settings, multifamily homes, not in retail. So what do you say to those business owners who do feel like they're being unfairly punished right now?
Oh, I don't disagree. I don't think it's punishment. I do hope, and I do know that there are financial compensations now being set up for them, so which is good, and that's one of the things that we always think about. The other issue is that it has nothing to do with has to do with mobility of people. So we want people to stay at home as much as they can and not give them a reason to go out, and shop unnecessarily and so on. So I know that the side effect of that is businesses will suffer, but we want to reduce the mobility of the people. So a stay-at-home order has to have that in that where are you going to go? You got to stay home and don't go anywhere it's not essential. So I do get what you're saying. I agree with it, but at the same time, when we always advocate for these things, we always talk about, let's not forget them. They will be losing they'll be losing business. Obviously, they're allowed to sell curbside, but that's I know that's not going to save their business. In certain situations, but it has to do with mobility limitation. People staying at home as much as possible and removing those temptations as well. So that is an unfortunate side effect of this shutdown.
And just very quickly, golf courses, they're open this time?
Yes, they are apparently.
Okay.
Yes, they are. Again, it kind of sounds like an oxymoron, to me. But on the other hand, if you look at the stay-at-home order, it says stay at home unless you go for exercise. But I'm presuming you're going to go and do it on your own. You're not going to mix and mingle with others, and they're closing the clubhouses apparently. So.
Okay, thank you.
You're welcome.
Next question from Natasha Wood, Nation Valley News. Please go ahead.
Hello, Dr. Paul.
Hi.
I was just wondering, could I get some clarification on where and when the overbooking happened at the mass immunization site?
Hawkesbury Clinic yesterday.
Okay, thank you so much.
You're welcome.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. We have one more from the chat box, Dr. Paul.
Okay.
Quelles sont les écoles qui sont présentement fermées dans la région?
On a pas mal. Je n'ai pas la liste devant moi. Je peux vous dire que c'est sûr que on a Saint-Patrick, Académie Seigneurie, on a l'autre, école secondaire à Castleman, et on a école secondaire à Hawkesbury, mais on a ajouté 3 autres aujourd'hui dont je ne me souviens pas. Je n'ai pas la liste sur moi. Ça va être sur le site web.
Merci. Those are all the questions for today, Dr. Paul.
Thank you very much. Merci.